our order that we're issuing for May 1, all health procedures that can be done that do not require an overnight stay in a hospital, we will be able to move forward with those procedures, operations or procedures. And I would ask you to remember that under the old order, when surgeries were necessary, even if the person stayed overnight, those were still allowed. For example, and this is from the order that was issued before, a threat to the patient's life if surgery or procedure is delayed. Those have always been allowed. 2, a threat of permanent dysfunction of an extremity or organ system, or possibly the spread of cancer. Those have certainly been allowed all through this. 3, pain. Someone has significant pain, and there's a procedure that can be done to alleviate that pain. Those have always been allowed. 4, the presence of severe symptoms causing an inability to perform the normal actions of daily life. So those have all been there. So we build upon those and then include any procedure that can be done where the person does not spend the night in the hospital. We also, dentists, veterinarians should also, beginning May 1, be able to be at full steam ahead. So all of this occurs on May 1. The only thing that is left is some elective surgeries, and as we see how we're moving forward and the availability of PPE, we will, when that time is appropriate, open that up as well. But this is a major change. And I know Dr. Acton will talk in a little bit about something that has occurred not as a result of our order, but something that has occurred because people have been afraid. People have been afraid to go to their doctor. People have been afraid to go to the hospital. And so, irrespective of these orders that have never blocked that, we have seen, for example, baby visits have gone down. Many things have gone down. And Dr. Acton is going to talk a little bit about that and the importance of kind of getting back in the game in regard to making sure your children, making sure yourself are having the appointments that you need. I want to move now to May 4th. May 4th, manufacturing, distribution, and construction. That will be opened up. As I said, we've learned a lot from businesses that stayed open. And some of the things that we have provided in this order, we've learned, frankly, from business. But again, it goes back what we're going to require of the companies that open up, and also any company that's already open. When these orders go in on May 4th, this will apply to any manufacturing, any distribution, any construction, whether it was open before or not. Again, what I think people should look at is how we are doing it. And we're doing it in as safe of way as humanly possible based upon what we have learned and what health experts have advised us. So let's look at that chart. In fact, before I do that, let me call your attention to this one, because this one, COVID-19, responsible protocols for getting Ohio back to work. So these will, by and large, apply to any company that will be opened up under today's orders or future orders. And we've kind of done it, the goal, protect the health of employees and customers, their families, support community efforts to control the spread of the virus, lead in responsibly getting Ohio back to work. Protocols for all business. 1, and we've summarized it in kind of a little quote here: no mask, no work, no service, no exception. So every employee will have to have a facial covering. And again, these don't have to be fancy. but a facial covering is very important. Require face coverings for employees and clients and customers at all times. 2, conduct daily health assessments by employers and employees, self-evaluation to determine if that person is fit for duty. 3, good hygiene at all times, hand washing, social distancing. 4, clean and sanitize workplaces throughout workday and at the close of business. And over here, limit capacity to meet social distancing guidelines. At a minimum, no more than 50% of the fire code. And it says here, use appointment setting where possible to limit congestion. Again, that depends on the nature, obviously, of the business. Take the following actions when a COVID-19 infection is identified. Immediately report employer or customer to the local health department. Work with the local health department to identify potentially exposed individuals to help facilitate appropriate communication, contact tracing, and shut down the shop floor for deep sanitation if possible. So these are kind of the basic principles. Wanted to put it on one page so people could just look at it, see it, pretty easy to understand. So these will all be up on our webpage, I believe, by 5 o'clock, 3 o'clock. 3 o'clock, I guess, they'll be up. So they'll be up on our webpage, and people can look at them. Now let's go directly to the manufacturing. And again, these are very, very consistent with what was on the more general slide that we just had over here. Let me just say a couple of things. Again, it's basic principles. Distancing. People have to be kept apart. If they can't physically be kept apart, there's got to be a screen, there's got to be something that can protect them. We've seen businesses, manufacturing companies that have been able to do every single one of these requirements. Many companies that are out there today are actually doing. Again, you'll be able to look at these and up on the web page, and any manufacturing company who's looking at that May 4th date, distribution company, construction company will have all of that available. Let me also say on May 4th, general offices will be able to be open. This is the chart for that, or it will be in a moment. That's the, and I'll just call attention to several things on here, but to me the most important is companies have found out that many of the members of their office can work from home and be just as efficient. We are asking companies as they go back into their office space to continue to do that as much as humanly possible. Continue to have people work from home. Again, we are all in this together, and what they do is going to allow us to move forward quicker as far as the opening of Ohio. So personnel work from home if at all humanly possible. Let me go now to May 12th. May 12th, consumer, retail, and services. Again, will be up on the web page. It's pretty simple. It is one page, but maybe call your attention to several things that are in fact up there. One, all employees will wear facial covering. The same thing will be true in regard to customers. So we encourage every Ohioan, when you're out in public, to wear a facial covering. We are not going to mandate that, but when someone as a customer goes into a business, they will have to have that facial covering because they will be dealing in a retail setting, and they will be dealing with the people who are working there. And the thing that we have learned, that Dr. Acton has talked a lot about, and several of the doctors who we've had Skyped in here have talked about, is that really when you put that on, facial covering, you're protecting the other person. And so when two people do that, Each one is protecting the other one. It is not a substitute for social distancing, but it is, as Dr. Acton has said, like the Swiss cheese, we just keep layering things on. The more things you do, the more protection that we provide. So this may be a little different, walking in to a store, but all these requirements, of course, will be in place for companies that are already open. For example, the grocery stores that have been allowed to be open. When we get to May 12th, every retail outlet that is open will have to be able to follow these particular protocols.